Welcome back to Daytime here on Rogers TV. This is a really great topic, I think, because it's something that most of us do.
Yeah.
You know,
or
and
should be doing.
we
That's
should
for sure.
be doing. And the thing is that you know, even if we don't walk long distances, when you do, you can feel it, right? Or if you spend the day on your feet, you can really feel it. And there's ways that you can actually care for the health of your feet, and we're going to find out exactly how. It's good to see you again.
Thank you.
You look all tanned and rested and happy and relaxed. and I was correct in the beginning, right, when I said this was inspired by your travels. Is that right? Tell us.
Exactly. Well, I get ideas for all the concepts of presenting different health topics from the things that happen in life.
Right.
And we just recently came back from a fantastic cruise. And as we were coming back from the day's journeys, you know, it's being out 10 hours touring around walking, people were coming back and they were like, oh, my foot hurts here or there or whatnot. And I thought, you know what? I need to talk about this.
Yeah.
So what's happening to our feet when we're walking that causes all this pain?
Well, great question. I mean, there's tons of bones in our feet, which all have tendons and ligaments that join and attach. And every time you take a step, there's 900 pounds per square inch of pressure that actually comes down on your foot. So it's no wonder that at some point in time you're going to have foot pain.
Right.
And then if we take a look at shoes, you know, the trend was that women were wearing the flat shoes with the gladiator, you know, style, but they're flat.
Right.
And they don't give you a lot of support, or high heels. Or the other thing, we'd be hiking up a mountain and I'd be looking, there'd be a woman with higher heels on.
Don't judge me, Dr. Joël.
I was going to ask you, by the way, was Jill on the same European vacation?
And I actually took pictures of, you know.
That's funny because
okay,
it's true in Europe.
Yeah.
I mean, in Paris, where the girls on their bikes, the big high heels, and in the cobblestones, high heels, it's really crazy.
Exactly.
Okay, so what kind of foot problems are we talking about?
Okay, well, there's lots of different ones, so I thought I would just talk about two today.
Sure. Okay.
I thought I'd talk about plantar fasciitis, and basically what that is I'm just going to show you a little picture of the foot. And essentially, the plantar fascia is, it starts with your big toe, and it's this tissue that runs all the way up to your heel. So if you can just imagine, if your foot is flat, or if you put a lot of weight on that, eventually this is going to become irritated, and we get inflammation, or we get a breakdown in collagen tissue. And that causes the pain.
So how do we get rid of that pain then?
Okay, well, there's many different ways that we can do that, and essentially what you want to do is have a proper gait assessment.
Okay.
But perhaps before we go there, if we could just finish talking about these, and then I'll get into the demos.
Okay.
Okay, so the other thing that can happen is that when we're looking at somebody's gait, if you look at somebody walking, a normal alignment is when the foot contacts the ground very nicely, and you'll see a nice foot impression. So I did this morning.
This is a good one.
Yeah.
Okay.
So
that's hold that shot. There we go. This is a good one.
That's normal.
All right.
You can see the basic alignment here, and there's some white space here, and that's my foot coming down, contacting the ground, and all pressure points are about equal.
Okay.
So that's a normal alignment. Okay. But if you have a genetic tendency, or if you have a pelvic or other structural problem, you might overpronate. And what that means is the foot glides out. Right. So we've all seen somebody walking, and they're kind of walking where their gait, and you can see that the pressure's on the inside of the shoe. So if you're actually looking at somebody's shoe from the back, you actually see it worn away on that inside edge. So what'll happen, so again, that's a neutral foot. So what'll happen in that scenario is we'll get an overpronation. So this is the footprint that we will tend to see if a person puts their foot down.
Wow, that's very flat.
It is very flat, and it can happen from flat feet as well. So that's one thing. Oversupination, which is the exact opposite, is when the foot scoops in.
Okay.
It's you've got more pressure on the outside, so this is the foot impression that we're going to see. Okay. The second kind of foot injury would be Achilles tendonitis. And so basically your heel has this wonderful tendon that attaches your calf muscle to the bottom of the calcaneus, which is your heel. And that, when that becomes inflamed or overstressed, that's where you're going to feel the pain.
This is what I have right now, and it's extremely painful.
Yeah, it's,
Oh, it's terrible.
Debilitating, like you can't walk. And
it's driving me crazy because I can't run right now, and I miss it so much.
Well, it's a good thing she's here because you got to get it fixed.
Right,
I know.
Right.
I've been telling you for weeks.
Okay, so while I talk about that, I'm going to get somebody to put baby oil on their feet so I can take an
Notice how
impression.
she looked at me on that one, eh?
I don't mind doing it.
I'll do it.
Okay, well, whoever wants to.
Doesn't matter which foot.
So let's talk about maybe some solutions.
I'll do it too. How's that?
Sure. So let's talk about some solutions. So first of all, acupuncture is going to be really great for that. Also, things that help to reduce inflammation.
I never even thought of that.
Yeah, so because acupuncture can help reduce pain and inflammation.
Okay.
So a few sessions of acupuncture can be wonderful. The other thing, of course, is ice. So you're just going to rest. And so after you put the baby oil on your foot, what you're going to do...
Rubbing myself with baby oil on live television.
You're just going to step on this piece of paper so that I can get a foot impression.
Okay, just step on it flat.
Yep.
Okay.
Yep.
Okay.
Oh, sorry.
So what we're going to do is we're going to take a look at it once you finish that, and we're going to take a look at how your gait is.
Uh-oh. Well, I've been outed. Here we go.
All right.
Really?
So when we look at Derek's, that actually looks pretty good.
Not bad? Okay.
Yeah, you have a little bit of supination going on.
Right.
Tiny, tiny bit.
Okay.
Okay?
Look.
Oh, okay.
I've got a lot, I think.
There's
Yes.
TL. Okay. TL, you have a little bit more supination going on. So your foot is rotating on the inside. So you have more pressure on the lateral part of your foot. So you would be a person that might be more prone to plantar fasciitis or Achilles tendonitis.
Well, there's my answer.
There's your answer why you have it. Now
Yeah.
we need to find out what she needs to do about
Okay.
it. Right?
So acupuncture.
I thought I was going to wipe off your sock. I thought it was
Also some structural support, having a good fitting running shoe. The running room does great fittings for proper assessment of proper running shoes. Or you could move to an orthotic. You can go to a general orthotic or a custom orthotic that gives you support in the right places. So that's a good option. Shoes, there are shoes customized to give you some general support to, again, make sure that your foot is hitting the ground in the right spots.
Okay.
Going back to treatments, natural treatments, we have acupuncture, which is great. We also have exercises.
Okay.
Right.
So basically, one of the reasons why this happens is your calf muscle might be tight.
Okay.
So some simple exercises that you can do are calf stretches. So basically, you're going to have a wall here. You're going to use pressure. You're just going to be allowing a bit of an angle here and just using pressure to stretch out this calf muscle.
Okay.
Another simple one would be going on a step and then basically going on your tiptoes and then allowing your feet to actually relax back like this.
Okay.
And that's allowing your calves to stretch. If you're in a lot of pain, you can do that one from a chair. So basically you're sitting and you're elevating your feet and then you're lowering the feet, elevating and lowering. Another great option for plantar fasciitis is just simply taking a tennis ball or something that's round and then basically giving your foot a massage. So you're basically rolling back and forth.
These are my kind of exercises.
Yeah.
I know.
Yeah.
You can do them all sitting down.
This is great. I love this workout.
It's fantastic education for
Yeah.
you. You know, you're just the best. And I want to tell everybody that you can find more information at her website at optihealth.ca. You can, first of all, read the newsletters because her newsletters are extremely comprehensive. They have all this information every single month. Or you can get in touch with her and go make an appointment and speak to her directly at optihealth.ca. We're going to take a quick break.